Hello, my name's Lorraine Cowley. I'm a Principal Genetic Counsellor at the Northern Genetics Service. I'm based at the Centre for Life in Newcastle, but we also have another base in Teesside. I want to talk today about the Cancer Genetics Service. First of all, who might be referred and why, and what our purpose is. So people might be referred to us because they have a strong family history of cancer, or they may have a personal diagnosis of cancer. So we know that cancer is a common illness and half of us will get cancer at some point in our lives, and all cancer is caused because our cells lose their genetic control. But some people have an inherited spelling change in a gene, and that means from birth they have a higher lifetime chance of getting cancer. And those are the families that we're trying to find through our service. In some cases, we can identify the spelling change in the family through genetic testing and offer testing to other family members. But in the majority of cases, we can't find the spelling change, but we can still help people to manage their higher chance of getting cancer. So what kind of family history would make us think that there might be a higher chance of cancer? Well, we want to find families where more than one person in the family has had the same type of cancer or cancers that we know can be genetically linked. Like, for example, we know that breast and ovarian cancers can be caused by the same spelling change. We also would want to know if anyone has developed cancer at an unusually young age, like we know that breast cancer under the age of 40 is more unusual, as is bowel cancer under the age of 50. When cancer is caused by a spelling change in a family, we usually see more than one generation affected by those cancers. And the purpose of finding these families is so that we can offer additional screening and risk management to those who have a higher than the population's chance of developing cancer because of their family history. So obviously at the moment we can't change genes, but we can help to manage cancer risks. And we manage risks by having additional screening, by helping people to be more aware and alert to symptoms and report them early to their GP for investigation, and also by a change in our lifestyle. So, as I've said, we can't always identify a genetic cause in families, but when we do, we know that with the majority of cancer genes, that if a person in the family has a gene change, then each of their children, their brothers and sisters and parents will each have a 50-50 risk of also having the same gene change. Some people might not be aware of that. Some people might want to know that, and some people might not want to know that. And we work within families to try and get the best possible outcomes for each individual within that family by respecting their decisions to know or not to know, and to try to arrange additional screening or risk management for all who need and want it. So as I've said, you may be referred by your GP because of your family history, or if you've had a cancer diagnosis, your surgeon or oncologist might refer you. And sometimes, which happens more often now, people who have had cancer have already had some form of genetic testing, usually via their surgeons or cancer doctors. And those tests may have been done on their tumour samples and might flag that there's a possibility of an inherited spelling change in a gene. So after referral, what happens next? So most people who are referred to us are first contacted by our Macmillan Cancer Family History Service, which is based in Teesside, and they will send out a family history questionnaire. Now, it's quite a large document asking for details of your relatives, and particularly those who have had cancer. And we completely understand that this can be a big ask for people to fill in, and it can be particularly difficult if you're also having cancer treatment. So I should explain why we need it. Well, we need the information so that we can draw out your family tree and start to look for patterns of cancer in the family to see if the cancers in your family are more likely due to chance, or to see whether there may be an inherited susceptibility to cancer in your family. If any of your relatives have sadly died from cancer, we'll get in touch with Cancer Registry to confirm what kind of cancer they had. And that's not because we don't believe families, but we know that some people in families don't talk about cancer, or sometimes the wrong information is passed down. So confirming the type of cancer helps us to work out the best advice to give to you. And if your relatives have survived their cancer, we need their permission to find out information about the type of cancer they had. And if that's the case, we'll ask you to pass on consent forms to your relatives. Again, we completely understand that this is a lot of work and can be difficult to do for lots of reasons. Some people don't want to ask their relatives about this for fear of upsetting them, and some people aren't in touch with their relatives. But even if you can't fully complete the questionnaire, please send it back with any information at all, as that's a starting point for us to try to assess your family's chances of getting cancer and whether you and they should be referred for additional screening. Once we've collected all of the information that we can at this stage, we will look at your family tree and let you know by letter whether we need to see you at an appointment to discuss things further and maybe look into the possibility of genetic testing, or whether you need to have additional screening, or whether it's most likely that the cancers in your family have happened by chance and we don't think that there is a genetic risk for your family. So that whole process from being referred to receiving a letter with your risk assessment or an appointment takes up to 18 weeks. And if you're not sure about anything at any stage of the process, please use the telephone numbers that we give you to ask for help. And we're very happy to try to support you in the best way possible to gather the information. And if you can't get the information, please do let us know and still send in the family history questionnaire. So I really hope explaining this has been helpful for you, and please don't hesitate to contact us if you have any questions, and thank you very much for listening.